All right, well, welcome to our Allied Health Admissions Information session. So we are going to go through this evening and discuss our different admissions processes and discuss the various programs, their requirements, and a little bit about each program from an instructor perspective. So first, let's talk about admissions into Johnny Logan College. So we are an open admissions institution. What that means is that if you apply, you are automatically in. We do not send a denial letter or an acceptance letter. You end up receiving an email, so I'll discuss that here in a little bit. We have several applications on our website to choose from. For the most part, it depends on what type of student you are. If you're a returning student, if you've been to college before, you're going to fill out that returning student application. For the most part, students are filling out the first-time freshman application. So if you haven't ever taken credits with us before, or it's your first time in college, you would fill out that first-time freshman application. This goes for our dual credit students as well. So if you were a dual credit early college student, even if you've taken those dual credit classes with us, you are still required to fill out that first-time freshman application. So your first step is going to be to apply to the institution by doing that first-time freshman application or whichever one applies to you. You then send your final high school transcripts or GED, whatever transcripts you have. You will send those, and they have to be final with the graduation date on them. And you would just send those to our admissions office. You also want to submit proof of residency. So maybe a driver's license, a utility bill, or a lease to show that you live in residency. Students who do not provide proof of residency are then charged out of residence, out of district tuition. So it's automatic out of district tuition unless or until you show proof. So you want to do that at least 10 days before your semester or classes start. So once you've applied, what you can expect is an email that's kind of like our acceptance letter. You receive an email welcoming you to the college and letting you know your next steps. You get assigned a student ID, a vol mail, which is our Johnny Logan email, and you set your passwords and information up through that. If you were a dual credit or early college student, you have a student ID and you have a vol mail, and that does follow you. Even though you have to do the first-time freshman application, your student ID does follow you and your vol mail, so that won't be new to you. This email will also talk about your next steps for your My JALC, which is accessing your student portal. Your student portal is where you can view your class schedule, you can pay your tuition and fees, you can view your award letter if you're getting and receiving financial aid or scholarships. So it's really important to be accessing that student portal and checking your email regularly. So then tonight we're discussing our various allied health programs, and each of those programs require their own application processes. So let's go through those. So several of those programs are requiring these specific restricted entries. So depending on the program, there is a specific entry exam. They're necessary because of classroom size limitations and our laboratories or clinical sites. So we want to make sure that all of our students are having a great experience and opportunity. And because our class sizes are limited and maybe some of our laboratories are limited in size, there are these requirements set in place. Our students are encouraged to complete as many of the program's general education courses as possible prior to entry into the program. Now, this isn't a requirement per se, but it does increase our students' probability of successfully completing their course because you don't want to be taking some of those general electives while you're in the program taking courses because it just adds to your course load. Some of those, courses can be pretty challenging. So you want to make sure that you're able to focus solely on your program. So the admissions process requires you to first, like we talked about, be admitted to the college as an institution. So overall, make sure you are enrolled in the college first. So you've applied and you've gotten that student ID. I'm getting a little bit of feedback from someone on the call. So if you are on, can you please mute your mic? Let me go back here. Okay. So apply to the program before registering for your pre-entrance exam. So step one is applying for admissions through the college, getting your student ID and getting all of that. Then you will apply to your specific program, and then you sign up for your pre-entrance exam. You want to be checking your email frequently throughout this admissions application process, as the college and the testing service department and admissions will be corresponding with you through email. So it's really important to be checking those emails frequently. So here are the various restricted entry programs. So our pre-entrance exam is required for each of these programs except our nursing assistant. Instructions on how to register for the online exam for these pre-entrance exams and paying the exam fee. All of that is on our testing services website. So you do have to register in advance for these tests. There are deadlines for each program to ensure that you're meeting these deadlines and testing in a timely manner. Please be sure you would be doing that. And all of that is listed in each packet. So our adult cardiac diagnostic medical sonography program requires the TEAS test, and it has all of this information in that packet listed. As well as our medical assisting, the TEAS test, our medical lab tech TEAS test. So all of these here. Phlebotomy only requires our Accuplacer testing for our reading section, and that is our college's our testing, placement testing. And then the surgical tech also requires our TEAS test. I see that Christy also was able to join us. Does anyone have anything to add to this slide or? Okay. So again, prior to signing up for your test date, you want to review and complete the application for your program of interest. So those various programs we just discussed. You sign up online for a test date. So you do have to pick that in advance. And you can only sign up for 2 dates in an academic year. And those dates have to be at least 21 days apart. Also, for any reason, if you are missing your test date, you need to correspond with the testing services office in advance, if at all possible, about needing to reschedule your test date. If you do a no-show just the day of, one of those dates is then counted as you tested, so you lose that date essentially. So you want to make sure that you're either rescheduling and communicating with the testing office, or that you're able to stick to that original test date that you've chosen. Your photo ID is required on exam day, so you have to verify your identity. You're not going to be able to test until you've done that the day of. Also, we accept credit or debit card on exam day for payment, so you pay the day of, and that is required, or students are not allowed to test. And then after registering for a seat, students can go to this website and create an account. So you have to complete this prior to your exam date, or you're not going to be able to sit for the exam. And then the TEAS testing cost is $70 plus tax here. All right, let me go back here really quick, and I want to make sure I can see you all too. Okay, so that is pretty much our information right now to cover over testing. We're going to move on now and talk about some of our programs, and then we can discuss any questions that arise throughout or any questions at the end if there are questions about testing. So first we have our adult cardiac diagnostic medical sonography program.
Do you want me to go ahead and speak to
Yeah.
what is on the PowerPoint? Okay, so with the cardiac diagnostic medical sonography program, our general courses can be taken concurrently within the program. So you don't necessarily have to complete these general education courses prior to applying for the program or prior to starting the program. We've made room within the curriculum for you to be able to take these courses along with the bulk of the courses that focus directly on cardiac sonography. And you can see them listed on the slide in front of you. Can we go to the next slide, or do you need to add any additional information with the courses that are listed? You're on mute.
Is there anything in particular you would like to share about any of the courses, or if not, I can go on to the next slide.
Well, basically what's listed here are the courses that are taken concurrently within the program. College 101 is the orientation that all students need to take prior to coming into the college environment. Cardiopulmonary resuscitation is a CPR course that is required for all students to have before they go out to the clinical sites, and that is required the first semester within the program. Medical terminology is a course that I do require for students to have so that they can have that basic knowledge of the medical language that's spoken within the clinical settings. Human anatomy and physiology, the Bio 206 would need to be taken prior to the cardiac anatomy classes, or and that would have to be passed prior to moving forward with some of the cardiac anatomy classes as well on the program. So that is set up specifically, that prerequisite is, or co-requisite is set up specifically that that one does need to be taken and passed prior to progressing within the program itself. College algebra and math is required. We do have some math that is required within the program, and having that basic math knowledge is a plus for students, and it is also a requirement through our accreditation organization that sets the guidelines that we go by. Along with physics, technical physics or physics for non-science majors may be taken, one or the other. Both of them do not need to be taken, but the students are able to pick which one they would like to take. And then the speech or the communications is another requirement that is a general education course that is set by our accreditation agency for the students to take. They can pick either taking speech or interpersonal communications.
Okay, thank you.
So some more information about the program and what to expect while in the program is it is a full-time commitment for students. We're in class a lot. All of the classes are face-to-face. There's only one course that is online, and that is the very last semester of the program. And that is when the students are getting ready to graduate. So they only have clinicals, and they do have an online course that they have to complete, which helps them get ready to take the credentialing examinations. As far as classes, like I said, all of the classes are set up in the program guide. They're set up in a progressive order. So that program guide that we have for the program needs to be followed in that set order. So it's real easy to follow, and students, since it is a program, students can follow that, and they know what courses are coming up next into the next semester and what they can prepare for, not only mentally knowing what's ahead of them, but also financially as well. Again, it's a full-time commitment. Students find it very difficult to work full-time. Actually, you really can't work full-time while going through the program. Some students do find that they can manage part-time work, maybe 20 hours a week. But other than that, it's not recommended for students because of the curriculum and the demands of the courses and the study time that needs to be taken. Now with clinicals, students do have clinical rotations. That's where they get their experience out at the clinical sites. We have a clinical rotation in their second semester in the program, their third semester, fourth semester, and then their final semester. So they are out at the clinical sites frequently. Not all clinical sites are local. We do have local clinical sites, but with the amount of students that we have, with a 1-to-1 ratio of a student per clinical site, we do have some clinical sites that are further away from the college, and it may require the students to commute and to possibly have overnight accommodations that they would need to stay in that area until they complete their rotation for the week. We have it set to where the students go from 2 days per week up to 4 days per week in their final semester. So just be prepared that this program is highly mobile, and that needs to be taken in consideration as well when thinking about applying to the program, or it's not a stress or a strain on the students to be able to successfully complete the program. The job outlook is very, very good. Cardiac sonographers are in high demand. I frequently get a lot of hospitals and recruiters that are always looking for cardiac sonographers to fill places that are available. A lot of times students who do their clinicals at the hospitals, sometimes they have a job before they even graduate. I've had 100% job placement rate with all of my students for the past 6 years that I've been here. And it's a very good outlook for students. They can find a job almost anywhere they would like to go. It may not always be in the local area, but they can be in the local area. They can travel to wherever they want. Students also, I want to add, that's not on the slide, is that students do have to, in order to become registered after the program, they do have to take 2 credentialing exams. One of the credentialing exams is physics, and the other credentialing exam is adult echocardiography. And in order for the students to become registered and more employable, having that credential behind their name, those exams prior to graduation. And since our program is accredited through KHEP, students do have that ability to be able to take those exams prior to graduating. That way they can have everything done, and whenever they graduate, they're ready for employment and ready to start their job.
Okay, thank you. Do you have anything else to add?
I don't. I think that sums it up. I'm not sure if Kristen would have anything to add that I may have forgotten.
No, no, I think
Okay.
the only other thing you maybe didn't mention is we are only one of two credited adult cardiac sonography programs in Illinois.
Okay, great. And that 100% job placement, that's really awesome. So, all right, now we have our medical assistant.
I would like to speak on the medical assisting program. My name is Kristen Yasanovich, and I'm the dean over all of the health science programs. We do have a lead faculty member for this program. Her name is Renee Lacey, and so she is responsible for this certificate. So if you can look at your screen, you can see that there are two courses that we require prior to you getting into the medical assisting program. That is in addition to the TEAS test and the admission applications. OFT 115, which is basic keyboarding, and the certified nurse assistant training or nurse assistant training, NAD 101. Those classes have to be complete to come into the program. The program itself then has a general education course within it, ALH 217, which is midterm. And then there are 23 credit hours of medical assisting credits. This is a certificate program. It can be completed in 2 semesters. You start in the fall semester and you then complete the spring semester and you are a certificate graduate. Classes usually meet in the medical assisting classroom on campus. They do have a dedicated classroom with some simulated office space in the back. Classes meet 2 days a week. Then if you want to go ahead and flip the slide to the next slide. So classes meet 2 days a week during the daytime hours, and then that frees you up for the other couple of days a week that you can do your clinical time. Clinical options can be completed locally. We have clinical agreements with several area medical clinics in the area, including Shawnee Healthcare, CRHPC Corporation, SIH, Deaconess, Marshall Browning. So really this program, if you live in a certain region, we can almost get you a medical office to do your clinical time in that local region if you would like. Students complete 160 hours of on-the-job training in their last course in the medical assisting program. As far as job placement, the jobs for medical assistants are in very high demand. They have an average salary in Illinois of around $44,000 a year. Roughly 20, 21, $22 an hour. And the curriculum itself, it gives you what you need to be successful in running the front office, is how Renee would describe it. And then that would be as far as billing and coding and things like that. And that's why we require you to have the keyboarding course up front. And then also you'll be proficient to take over what we call the backside of a medical office, meaning the spaces where you take care of the patients and do vital signs, even phlebotomies and lab draws and things like that for doctors' offices and clinics, urgent cares in the area. So that's really all I have on the medical assisting program.
Okay,
At this
thank
time.
you. Thank you, Kristen.
You're welcome.
All right, next we have our medical lab tech.
Sorry, I was trying to unmute myself. I've so I'm Michelle Lampley. I am the Medical Laboratory Technology Program Coordinator at John A. Logan. And a little bit about my program. So we do have one prereq in order to get in after you apply and to start the program. You would have to complete Bio 205, which is Human Anatomy and Physiology 1. The rest of the gen eds, they can be completed during the program. Some of them I would highly recommend, if you can, to take them beforehand. The reason why I say that is because the second year of the MLT program, and I'll talk about it when it gets in the clinical area, the time constraint, clinicals are usually during the day. They work 8-hour days, and so having a day class is not an option. So it would have to be a night class, and sometimes it's just a lot to do to complete a class and be in a clinical. So as many gen eds that can be taken, I would highly recommend that, to take that before you enter into the core courses. But you do have to take human anatomy and physiology too. Chemistry 1 and chemistry 2, either college algebra or an IAI math, general microbiology, English comp, speech, and general psychology. As far as the MLT courses, it's a very sciencey based program. So I would definitely suggest that you would need to like science in order to excel in the program. We're going to study a lot of things about the body and diagnostics for, diagnosing medical conditions. We help the physicians tremendously come up with a diagnosis for the patients. A hospital wouldn't run without us. We're kind of behind the scenes, but wouldn't run without us. So the core courses, we're going to be studying hematology, microbiology, urinalysis, serology, blood banking. So that's a class where if you've ever donated blood before, we're the ones that would get that blood, and we would make sure that it was compatible with our patients. And then we also have another clinical chemistry class. So every class that we have, it does consist of a lecture portion and a lab portion with the class. We try to keep it down to where if you're a first year student, you would only have to come 2 days a week. Second year students would come on a separate 2 days a week. So we try to keep it a little bit separate and closer on the, keep them compiled to the same days to make it easier on the students. As far as clinicals, so there are 3 clinical rotations in the MLT program. First year students have a small clinical in their second semester where they are doing a phlebotomy clinical at a local hospital. They only have to complete about 32 hours, so it is a really small clinical. As far as the other 2 clinicals, they are the last 10 weeks of the second year. So in semesters 3 and 4, students are out in the clinical sites. They have to do 240 hours for each one of those clinicals. And then it's Monday through Friday for the entirety of the clinical time. I will say that my students are in high demand. The job outlook is great. So the 20 plus years that I've been in the medical lab field, we've always been short-staffed. So my students generally will go into their clinicals, and then they are fought over to get the jobs. So I would say any student of mine that has not graduated with a job is by choice. Either they're moving away or they're going to continue with their education. It's not because the jobs aren't out there. And so even locally, there are jobs to be had. You could go anywhere in the United States and find a job. So definitely is sought after. You need to really enjoy science, I would say, would be one of the main takes from the MLT program is you need to like science.
And Michelle, would you say, so is this a position that students are maybe more on the back end, they don't interface with patients as much, they're working more in labs, or
Yeah, so this is a career So let's say you want to be in healthcare, but you don't want the one-on-one patient responsibility that a nurse would have. This
Yeah.
would be a good career for that. We're the hidden gem of the hospital, right? So people who generally see the lab, they think of phlebotomy, who are collecting lab samples, but we're actually behind the scenes doing the testing and getting that over to the physicians.
Okay, thank you. And you mentioned that, if you have students who graduate and they're not going into a job, maybe they're continuing their education. Do you see that if this is the scenario, that those students are going further for their education into something specific or not necessarily? Like, are they going on to be a PA, or are they going on to be, is there something specific you've seen through the years or no?
So generally, they're going on to get their MLS, which is the bachelor's degree, a step up from the MLT.
Okay.
But we have seen students that start out in the MLT program and then end up as physician's assistants. And I will say they make excellent physician's assistants. But yes, we do have bachelor's, master's degrees that you can go on for in the laboratory.
Okay. Thank you.
Mm-hmm.
All right. Next we have nursing. There's a lot to talk about here.
I'll try to keep it kind of brief. I do want to mention that just right here at the beginning, I have a nursing admission coordinator that can answer any question that you may have. Her name is Susan Phillips, and she can be reached by just emailing her first and last name, SUSANPHILLIPS @jalc.edu. She is also on our program page if you were to just Google nursing in the search bar at jalc.edu. So with nursing in general, we have 3 different types of nursing. We have the nursing assistant program, practical nursing, and associate degree. With the nursing assistant, that program can be completed in 8 weeks or 16 week options. We have usually 3 sections that run regularly every single semester, fall, spring, and summer. And we have a late start with this. We have evening options for nursing assistant. They do 40 hours of clinical in a long-term care setting, and the classes usually meet 2 days a week for multiple hours during the day. I'm going to say 4 to 5 hours during the day, a couple days a week, and then your clinical is usually done 4 10-hour shifts. With the nursing assistant, you do have to take the AccuPlacer reading. So that is something that if you're interested in nursing assistant, I would just recommend you go to the search bar at jalc.edu and type in testing services, and then you'll get where you need for that. They can help you sign up for the AccuPlacer, and they can also get you started on some of the things that you have to have with the application in order to sign up for the course, like I said, an 8-week course. So that's nursing assistant. You do not have to have the nursing assistant completed to go into the practical or the associate. It's a standalone. It obviously helps if you have nursing assistant experience when you go into the higher levels of licensed nursing, but you do not have to. So practical nursing, think of our practical and our associate degree nursing as a 1+1. So if you're not a nurse at all, you have to start at the practical nursing level at our program. You apply, you take the TEAS test, and then it is somewhat competitive. We have 2 program options for practical nursing. We have a full-time day program that runs pretty much 4 days a week through the daytime hours. We have a part-time evening program that usually runs 2 evenings a week and then a clinical day during the daytime hour. So those are 2 different options. Our full-time starts every August, and we take in 90 students. Our part-time starts every other spring, which it is starting in the spring of 2025, but you have to apply right now. Admission closes out at the end of this month, And we will be taking 40 into that part-time evening spot. I will say, starting the practical nursing program on the part-time evening is great if you have a full-time day job, because classes don't start until the 5 p.m. hour, so you can have a working day job Monday, 4 days a week, and still go to school in the evening to get a second degree nursing. So there are 3 gen eds that you have to take for nursing: AMP1, AMP2, and speech. And if you don't take speech, you can also substitute that for interpersonal communication, a course that we have at John A. So those are the 3 gen ed courses. I'm going to say the same thing that Michelle did. If you have those done prior to jumping in that curriculum, it is a little bit easier program, because sometimes you have to take those gen ed courses, AMP 1 and 2 in speech, in the evenings or online if it's speech. And it's just harder because you're trying to get through all the rigor of the nursing courses. The LPN program has high pass rates. Our pass rate is 98%. That means that when you get done with the LPN programs, you sit for a board licensing exam, and our school is 98% out of 100%. And I think the average in the nation is closer to the mid to high 80s. So we're higher than the national and the state average. We have very high job placement rates. We do clinicals for the LPN program at various local healthcare agencies. So we do hospitals, SIH, Deaconess, the Veterans Hospital in Marion. We also do some smaller hospitals, Marshall Browning in DuQuoin, Illinois. So we have several different clinical sites for our LPN program. Moving into the ADM program quickly, I know that I don't want to take up a ton of time, but the ADM program is nationally accredited. It is accredited by the Accreditation Commission of Nursing Education, or ASIN, in addition to the standards that the college has for accrediting. We have 3 program options for the associate degree nurse, and you apply separately for that once you're an LPN. So once you get your license in hand, LPN licensure in hand, you reapply for that second year. And we have 3 program options. We have a full-time option during the day, again, that goes during the daytime, a couple days a week, full-time. We have a part-time evening option where classes start in the evening in the 5 p.m. hour. It's a 5 semester. It takes 2 years to get through that. And then we have a hybrid online option. And that hybrid online option, classes are online, and then the lab time is face-to-face in the lab on campus, and the clinical time is at a local clinical facility. So we have 3 program options for students interested in associate degree nursing. And just so you know, associate degree, once you complete that, that's when you sit for your registered nursing license or become an RN. There are 2 general education courses for the associate degree program. That is microbiology, Bio 226 at John A. Logan, and chemistry. Those are both prereqs that you have to join then into that associate degree option. Our clinical sites in the associate degree program are at local healthcare facilities. So Southern Illinois Healthcare, Deaconess, Veterans Hospital in Marion, they work well with our program and always make room for us. I will say that our pass rate in the associate degree nursing program cumulatively is a 95% out of 100. And that is also higher than the state and national average. So again, you don't want to go through a curriculum and not pass your boards for your licensing exam. Job outlook, very lucrative for all levels of nursing. There are many recruitment opportunities. And I will say, in the world of nursing, if you can get through the education, there will be a job that will fit your lifestyle. There is office nursing, there's correctional nursing, there's outpatient facilities, there is travel nursing, hospitals, you name it. And then also, you can also specialize in nursing. You can become a nurse in mental health or a nurse in obstetrics and work on the OB unit on the floor in a hospital. And so there's lots of job opportunities. The average salary for an LPN, and this was just a quick facts, around 55 to 60,000 a year. RN average approximately 80,000 a year. The good thing with nursing is in a hospital, you have to work several shifts. So anytime you work evenings, nights, or weekends or holidays, because you have to have a nurse in a hospital 365 days a year, those always come with extra money to work some of those odd shifts that are hard to fit. Did I cover it all, you think, April?
Yeah, I think so, definitely. Yes, thank you.
Okay.
Next, we have our phlebotomy program.
Okay, so the phlebotomy program, it is a brand new program at John A. Logan. So we're currently just in the second cohort that we have had. It started last fall. So it's a 1-semester program. It's going to prepare the student as a career as a phlebotomist. They could be at a hospital, physician's office, surgery center, independent laboratories. They could work for LabCorp or Quest at drawing sites. But they are trained for venipunctures, and they also help to prepare samples for the lab technicians in order to get the testing done for the physician. So with this program, it's set to be completed in 1 semester. So students have to take ORI 100, which is college readiness and prep class. They also have to take ALH 101, which is the CPR. They have to take medical terminology. They also take MLT 120, and so that is a course that's in the MLT program, but it's set up so that phlebotomists, they are the face of the lab, so they work with MLTs. They're going to be more of who the public has their general interaction with, and so if they enjoy the lab, then it's set up to where you could already have a couple courses in the MLT program taken and complete, and then you could apply and jump into the MLT program. And then we also have Phlebotomy 101. This course is a hybrid course, and so the lecture material is online, but we do meet in person for lab hours. So it's an 8-week course. We do 6 hours a week in lab, and then the lecture is online. And then phlebotomy 102 is the clinical practicum. And so students have to do 192 hours over a 12-week period in local hospitals or clinic settings in the area. And then once completed, they have completed a certificate through John A. Logan, and then that allows them to set for the national registry through the ASCP. And so they could set for the PBT ASCP once they complete that. And it's been a success so far. So this semester we've had about half of a full class, and so they're really enjoying it and learning a lot. Phlebotomy outlook. So the job outlook, there's always phlebotomy jobs. So again, it's the lab setting, and you could find a job anywhere locally and throughout the United States with a job. And especially if you go through a program like this and you set for your ASC PBT, you're very marketable. So employers really like to see that.
Okay, thank you. All right, and then I think our last program for this evening to discuss is our surgical tech program.
Right. Hi, I'm Jennifer Jordan, and I'm the Surgical Technology Program Coordinator at John A. Logan. So our course guide students can come right out of high school, or they can just go ahead and start with not having any prerequisites prior to starting the program. So everything can be taken just as the program guide says, or if they have any of those courses or want to take any of those courses prior to, it does help them because the program is quite concentrated, and it's not easy. A lot of students think, oh, it'd be easy, but it's really not. It's a tough program. We do pharmacology in the core courses. And so if they can get some of the harder classes like the anatomy and physiology 1 and the anatomy and I can't even talk, physiology 2, and micro out of the way, the rest of those courses can be taken online, really. And might be a little bit easier to take along with the other core courses. If they wanted to knock them all out, that would be perfectly fine. And it would give them a lot of leeway in the program and not be so tight and stringent on them, because it is a tough program. So the English, and so there's 2 different English options for them. So they can take English composition, or they can take the professional technical writing. And then speech is the same way. They can do the speech, or they can do the interpersonal communications. Either one of those would work. And then we have an intro course, which just basically we go over the profession starting and what surgical technology is and what the job is all about. And we get into resume writing and interviewing and those types of things in that intro course. Then in the spring semester, it gets a little tougher. So we get into the pharmacology because we have to have that base knowledge of the solutions that we are handing over to the doctor. They may be antibiotic mix solutions, local anesthetics. So we have to have that base knowledge of the things that we're, handing off. We don't administer medication, but we draw it up and we, pass it off to the surgeon. So we have to have that knowledge. Then we also have the mock lab. So we have a gorgeous lab at John A. Logan, and we teach them to scrub and to pass instruments, all the things that a surgical technologist does, scrubbing their hands, draping the patient, positioning the patient, moving the patient, all of those things we're teaching them in that mock lab, where we want them to make the mistakes and we can correct those mistakes, because when they start that clinical in the summer semester, they're already learned from their mistakes and they're able to go out and work with the real patients at that point in the hospitals and surgery centers. So and then we also have the principles in practice, where it's teaching the didactic part of the things that we're learning in the laboratory in the mock OR. So really challenging semester, but then once they complete that, it goes in progression. The next semester, the summer semester, they're going to be taking procedures, surgical procedures. And so we're just breaking out into like general surgery, robotics, laparoscopic surgery, and then genitourinary, gynecology. And then we go into the next semester. They have a clinical that's attached to that. So we have various clinical sites. We do have several local sites ranging from hospitals to surgery centers. So students, it makes it a little bit tougher for them to work, especially a full-time job. So working a part-time job, we've got it to where they're in class 3 days a week. That's for all of the semesters. They have some sort of class or clinical at least 3 days a week. And then so it gives them a little leeway to maybe work weekends or the off days that they don't have classes. So they're working alongside surgical techs, surgeons, and they're getting the real experience in a live OR setting with real patients starting in the summer, going all the way through the last semester of the second year spring. So we've added an additional clinical, converting over from a 1-year certificate program into a 2-year associate degree program. And so students have a lot of experience as they graduate now. And our job outlook is, we're so short-staffed as it is right now. So the clinical sites are pretty much nabbing them up as soon as they can, that first or second clinical normally. Because they're short-staffed, they need those extra hands. And so, and it works out really well for us because the students are getting that extra experience. And the students are also getting to work alongside the people that they're going to work with, hopefully for a long time, their employers, the surgeons, and really get comfortable in that setting. So it's a great thing. And then in the spring semester, they're doing another procedures and they're doing another clinical. So it's not abnormal for them to already have a job come that end of the fall semester because of the shorthandedness that we have locally, not only locally, but it's national shortage. And so students get jobs absolutely no problem as long as they're looking for those jobs. I said we have a range of clinical sites. So we have northern sites. We go up as far as Centralia area and O'Fallon area. And then we go into Missouri to St. Francis Medical Center. And then I think Southeast is now Mercy Hospital. We have both of those. We have some surgery centers locally that also take students. So, I mean, we have all the different specialties for the students to also experience. They have to meet a surgical case count. They have to scrub in 120 cases. And there's a requirement. So many of those have to be in a first scrub roll. So they have to be setting the case up and basically being in control of the Mayo, because we are passing instruments to the surgeon, supplies, medications. So they have to know how to pass those appropriately and know at the appropriate times when to do that, when to initiate counts, because we have to be accounted for all the instrumentation, sponges and sharps. So they have to be fully participating and have all that knowledge. So trying to think if I'm leaving anything out. The pay has really increased with the increase of the requirement of a 2-year associate degree program. It has brought forth an increase in pay for surgical technologists. So you can look at least $24, $25 an hour starting out in some facilities. That may not be in all facilities, but definitely some of the hospitals. You might see that they also come with great benefits as well. Surgery centers, you might, it might differ a little bit because you don't have to work those holidays, those evenings or nights, whereas the hospital, you have that on call. So it's a 24/7, 365. So they always have to have that coverage. But you can make great money because you have the shift differentials, you have the call pay as well. And those calls, you're getting paid even if you don't get called in. Just being on call, you're making a little bit of money for that call. If you get called in, you're making good money on that call. So that's where a lot of techs get that extra pay, is by taking that call. They do have a variety of shifts at hospitals, usually may differ from some, facility to facility, but they usually, some of them have coverage from early morning up until early afternoon, evening-ish, maybe 6, 7, 8 o'clock. And then they're on call team will then take over for the rest of that time. So you're going to get that shift differential if you're working an afternoon or evening shift as well. Pass rates, we have to set, we are going for an initial accreditation at Johnny Logan. And since our recent move, so we're in the process of that accreditation process. So with that, the students set for the national board exam, and upon graduation, they have the potential of being a CST, that's a certified surgical technologist. So that makes them, eligible for a little bit higher pay. It's the gold standard test, and our pass rate upon transitioning over to Johnny Logan was 88%, which was really, really good. Our program, we accept in 20 students, and we usually graduate about 15 or so, maybe a little less than that, depending on years. So we have really good rates on that. Anything that I've missed, anybody?
I don't have anything else to add. Do you have anything, Kristen?
No.
Okay. All right. Thank you.
You're welcome.
All right. So this kind of concludes our allied health admissions programs. If you have any questions, please always reach out to us. You can reach out to us at our admissions or at our testing services email, or you can call our offices. These different programs, those deadlines are coming up quickly. Kristen, I'll let you kind of chime in. Is it the beginning of March?
The LPN is March 3rd, Monday, March 3rd is the deadline, and we'll probably hold really firm with that date.
Okay, yeah, I thought it was like March 1st or March 3rd, somewhere around there. So just keep in mind all of these, various programs that you have options to do, but you do definitely want to make sure you first